Good morning, and thank you to everyone who is able to come out today. I think that today is a very important day to let the community know what we have been working on for several weeks and where we're headed and what our priorities are moving forward. I want to thank Commissioner Gibson, who is able to come out, Commissioner Naft, who is en route, to all the other commissioners who have tirelessly been working to ensure that we had a regional plan. First and foremost, I want to thank our employees across Clark County. That's cities, county employees, UMC, hospital folks that are working to ensure that patient safety is number one, but also ensuring that their own families stay safe. So today what you're going to hear is you're going to hear from several different parts of our regional group that meets on a regular basis to address today's issues. Issues change. I want to be very clear. Issues change sometimes hourly, sometimes by day. And so we work in sync to ensure that we're looking at all of the places. What you're going to hear today is the homeless issue is obviously one of our biggest issues that we're trying to address today. So Kevin Schiller will address that. Mason Van Hollensing will address our medical surge. That is our next big issue that we have been working tirelessly on across the valley. You're also going to hear from Kevin McMahill, who will talk about the efforts that Metro is putting forward to ensure safety, not only for our officers that are out there, but for the general public. You're going to hear from Dr. Legon, who is going to tell you what are we doing, what type of social distancing should we be practicing, where are we at on test kits, and so you'll hear from him. And then we'll ensure that Chief Steinbeck, who is the lead of our multi-agency group, he will talk about things such as PPE. Where are we at on that? We have been working on that for a very long time. So you're going to hear directly from the folks that are helping us work through all of these hard decisions. As you know, this changes. This is not something that we planned for. However, I can tell you, Clark County, as a region, we are preparing, we are constantly changing, and we are navigating through these systems. For the general community that is out there, know that we work together across the valley. Every city is involved in these discussions. All of the county is involved in these discussions, and our experts that are here. So with that, I would like to turn it over to Mr. Schiller to talk about homeless, because that seems to be the topic of the morning. So if I can have Mr. Schiller come up first.
Good morning. Thank you, Chairwoman Kirkpatrick. So on the homeless front, the first thing I want to preface is before we even had the crisis, we had an ongoing deficit of services and support as we address this population. But the most dramatic impact that we've seen in the last week was we had several of our nonprofit partners and our sheltering partners that had to close down as a result of the crisis and what it was creating, especially when you look at that congregate care setting. So with that, effective last week into Friday and Saturday, we had set up kind of a safe sleep kind of emergency area at Cashman Field. Many of you have already seen that, but in that process, trying to meet the basic needs as we address the sheltering issue. In conjunction with that, effective Monday, in conjunction with the City of Las Vegas, we have funded and have been coordinating the construction of a facility which will sit at Cashman Field, which is primarily set to address those at different levels of positive quarantine and in need of isolation within that homeless population. With that, we have two other pieces as we address this population. The ongoing need for those that aren't testing positive, because as a result of this, we have seen a reduction in our shelter capacity across several of those providers, just based on the requirements and meeting the needs of social distancing for the population. So with that, we also are actively pursuing contracts with transitional housing, motels, hotels, and provider services, because many of these people need case management. In addition to that, those that do test positive and complete the isolation process, we do not want to put them back on the street. So our goal is to transition them into, as an example, motels and programs so we can support their structure. Again, this is a dramatic need. We are putting out, and I want to make sure I put this out today, we need people to reach out to us that have possible capacity so we can work with them in terms of both providing case management and the needed housing for individuals who are facing this, particularly across the homeless population. Again, the key piece to this is we're dealing with both the positive population as they screen into the shelter, because we can't have them go in, and we're dealing with the population that isn't and sheltering both of those. So specific to that, again, Cashman is going to be for those positive individuals that we need to quarantine, and then secondarily we're accessing various sites across the county. Actively, it's changing basically every hour so that we can meet the needs of this population. And again, want to put out, we need your help. So those that have accessible space, those that can provide the case manage, one of the key pieces is staffing to support these programs, and that's one of the biggest challenges we have ongoing. My apologies. I'd like now to introduce Mason Van Houweling from Medical Center.
Good morning, everyone. I'm Mason Van Houweling. I'm the Chief Executive Officer of University Medical Center here in Clark County. Just from a size level, we are a 541-bed hospital. Of that, 141 beds are intensive care beds. So just very early on, we have, for weeks and weeks now, we've stood up our Incident Command Center. We have followed all the CDC guidelines and the Southern Nevada Health District guidelines. We've altered and changed our visitor policy during this time to limit the exposure not only to our healthcare workers and our patients. We've also, several weeks now, postponed elective and surgeries to push those off. So we're conserving our resources, our staff, our PPE, our ventilators, and beds. I'm very proud of our team at UMC. The morale is high. Everybody is working hard. But as Commissioner Kirkpatrick said, this is just the beginning, and I equate this to not only a marathon but an ultra marathon, and we're prepared for that. So the hospital, the healthcare workers are doing their jobs. Please do all the things that we have recommended. Wash your hands, stay at home if you're sick, wipe down surfaces, social distancing. Those bold moves early on have really made a difference in what we're seeing in our state. So I want to iterate that as well. The staff, again, is doing great. We're sourcing as much PPE, personal protective equipment, as we can throughout the world. And so we're staying ahead of that. We've tested around 600 of our community members. Of that, about 20% of those have come back positive. And we're treating those patients as we speak, either back at UMC or back at their homes via telemedicine as well. So again, we're doing well. Ventilators we're good on. I know that's a big question. How many ventilators? We've got about 120 ventilators. About 50% of those are in use now, but it will go up. Every day we're seeing about a 10% increase in our numbers every single day. But I assure you we're doing all that we can, working with our partners, EMS, AMR, MedicWest, those companies to be able to make sure that we're treating patients in the right setting. As Commissioner Kirkpatrick said, if you can reach out to your primary care doctor, if you have those symptoms, please use that method versus going to an emergency room. If you're sick and you're difficulty breathing, chest pain, we need you to seek out the emergency room in those settings. So again, we appreciate all your help and staying home so we can do the fight on the front lines at the hospitals. With that, I'm going to introduce Under Sheriff Kevin Mackay to talk to you next on what Metro is doing. Kevin?
Thanks, Mason. Before I get started, I'd like to just take a second and thank Commissioner Kirkpatrick for the leadership she's displayed. We've been having these meetings at a very high level for a very long time. It didn't take the state or anybody else to ask us to come together to bring all of these very quality people together to start to figure out what we need to do here in Southern Nevada. And I'll tell you that an event of a magnitude like 1 October, all the very same people came together. And that was an event that lasted a couple of days that caused us, we had a lot of people injured and we had a lot of challenge, both medically and law enforcement wise and government wise. And then we saw a fairly rapid end to that, not to the end to the suffering of the individuals, but to the actual event. This is an event that continues, and it continues to get worse by day. However, I truly believe that the leadership that's been shown here has us well prepared moving into the future. I was asked to discuss what the crime picture looks like. What I will tell you is that not only as a policy group, all of our local law enforcement with Sheriff Lombardo and myself meet with all the other chiefs, all the other fire chiefs, all the other emergency managers, sometimes by telephone daily, because as a number of speakers ahead of me have said, this is changing hourly. And so we are very well prepared. We are seeing significant crime reduction since the beginning of the COVID virus. In my jurisdiction alone, violent crimes down about 20%, property crimes down about 28%, overall crime is down about 27%. One of the things that we were all concerned about with having all the kids home from school and non-essential employees home, that we would see an increase in domestic violence. As of today, we still see a 37% reduction in domestic violence crime. There are some issues. I'm not going to stand before you and tell you everything is perfect. We have had an increase in our traditional violent crime hotspots of firearm calls of about 35%, and so we're worried about that trend, and we're working on having the deployment of our officers back to those locations. Understanding that I also have to be very candid. We have 6,000 employees at the Las Vegas Metropolitan Police Department, and they don't have the luxury of going out and not having contact with the public. So we've had to take some steps for a very long time. Realistically, since the very beginning, we've had to teach our cops about hygiene and hand washing and gloves and protecting themselves really since the very beginning of all of their careers. Today, we've done the exact same things, right? We've followed the guidelines that the medical professionals have provided to us. We're having our cars disinfected. We have call screening that's going out so that when you call 311 or 911, we get the initial information. We ask you additional questions so that we could limit the exposure of our officers and our first responders. We work jointly with the firefighters as they're out on the scene to reduce their impact and the amount of people that potentially could be involved with an individual. Metro right now, we've had 39 officers tested, or completely tested. We have had 2 positive COVID responses. We're waiting on 15 of those tests. 22 of them were negative. We also have about 84 people currently quarantined because they had some exposure. It has not had an operational impact at the Las Vegas Metropolitan Police Department, and in speaking with my counterparts across Southern Nevada, there's been no operational impacts in their jurisdictions as well. What I would just simply ask, though, is that you've heard a number of pleas about please stay home, please practice social distancing. This is an unseen enemy. This is something that we have to rely on the experts to tell us. People like Dr. Legin and Mason and a number of others that can tell us what is the best recommended things to do. And we're imploring you, we're begging you, stay home. If you don't have to go out, don't go out. Stay out of those groups. You understand that we have these essential businesses and non-essential businesses. Please, the more that we cooperate, the more that we're effective in keeping that social distance from one another, the more rapidly that we will be able to recover here in Southern Nevada from the scourge of this virus. Thank you very much. And with that, I'd like to introduce Dr. Legin.
Thank you, Chief. Good morning. Yes, okay. Well, my name is Fermin Legin. I'm the acting Chief Health Officer for the Southern Nevada Health District. First, I want to announce that as today, we have 961 cases of coronavirus reported in our community. That includes 28 deaths. I also want to say that we feel very sorry about each one of those deaths because of the pain that it brings to the families when they lost a member. I also want to say that our staff have been working very hard, as well as our partners, trying to help in controlling this outbreak. We have our surveillance team and also other members of our staff working long hours and also having partners assisting us because our team is not enough for that task. So we have medical students, and we have also faculties from local schools, universities, colleges supporting our work. I also want to say that yesterday the Board of Health approved our organization to purchase a facility that it will be an alternate care facility that will house up to 40 people, and that will help with one of the issues that we are having difficulties in recent weeks, which is about whether it is homeless patients being diagnosed with coronavirus and having no place to be isolated, or whether it is visitors also having the same situation, as well as senior citizens living in assisted living facilities or nursing homes who are diagnosed with coronavirus, and they require isolation, but there have been difficulties getting that accomplished. So that facility will allow us to help the community on that regard in partnership with the other institutions that we have here at the county. I also want to say that it's very important for all of us to keep the social distancing, to make sure that we are not going out there to public places and spend time with a lot of people around, because that also contributes to the transmission of this disease. It's very important if somebody is feeling respiratory symptoms, fever, and it is a mild presentation, it's better for everybody if this person calls a physician instead of going to the medical office or the emergency room, because right now many medical offices are implementing telehealth, which makes possible that a physician will actually have a conversation with you, discuss your signs and symptoms, and make a recommendation of what you need to do next. And the most likely scenario is that you don't need to go to the emergency room of the hospital. You might just need to stay home and keep yourself in quarantine. It's important also that if you have respiratory symptoms today, assume that you have the coronavirus, and as opposed to trying to get out there and be tested. Regarding testing capabilities, since 2 weeks ago, we have the commercial labs offering the testing in our community. So now it's not only the public health lab at the health district. Also, we have the commercial labs that are available for any private provider. Any physician in the community can order those tests. And also, recently, some of our hospitals are able to have this testing in-house as well. So, again, I just want to repeat, the most important thing for us is to please stay home. If you are sick, call your physician. Don't go anywhere before getting a recommendation from your physician. And also, please make sure that you are following the recommendation from the governor, the county, and the authorities about what we need to do next. And I will stop here, and I will introduce Chief Steinbach. Chief.
Thank you, Dr. Lagan, again. And my name is John Steinbeck. I'm the fire chief for Clark County Fire Department. I also serve as the emergency manager for Clark County. I just want to assure everybody that just like Under Sheriff McMahill said, the Clark County Fire Department is fully staffed. We're fully available to assist and to go out and run all of the calls that we normally do, all of our 911 emergency medical calls, all of our fire calls. We are having no staffing issues right now and no reductions in service. These are very incredible men and women that are certainly up to the task to come out and respond to these emergency scenes. And it's our responsibility to make sure that we get them the tools, just like Mason from UMC was speaking about for the hospitals, so that they can safely do that. But right now we have no reduction in service and no reduction in the quality of service that we're able to provide. I want to commend this community because we have had a reduction in our EMS-related 911 calls, and that is because people are listening. People are listening to the message, and we really appreciate that. They are being more careful as to when they utilize the 911 system, and that diligence is paying off, and we appreciate it. Of course, you've heard that for the mild symptoms and the symptoms that Dr. Lagan described, to go to your primary care physician or to use the call numbers that are available, of course, on the Southern Nevada Health Department's website. But for 911, of course, if you have a respiratory issue and are having difficulty breathing, we do want you to call 911 for that. We do want to get you that assistance as quickly as we can. If someone is noticing that you are hypoxic, or you're noticing that yourself and your lips are kind of turning blue, we want that to be a signal for you to go ahead and still utilize our service, of course. And then if you have an altered level of consciousness and are becoming confused, and that is noted, that's another sign that we would be concerned with, and that we would still want to respond from 911. And then, of course, all of the calls that you've utilized 911 for in the past, with this added discretion, we are ready to assist you. Not only Clark County Fire Department, but all of the city fire departments are operating at the same level of strength, and our private ambulance companies are certainly providing the services at the same level that they have been. We do have the challenges with the PPE and the new environment. You will see just a little bit more care taken in the response as we are trying to protect our people and your people as well, but the level of care has not dropped off at all. Outside of the fire department, though, as far as emergency manager, we did activate the Multi-Agency Coordination Center. It's been activated since we found out about the very first patient here in Southern Nevada, and has maintained that activity level. The primary focus of that is in the name. It is for agency coordination, so that every day we are coordinating our activities with our hospitals, with our law enforcement, with public health, with we have what we call emergency support functions. And we have 15 of those that are active within our multi-agency coordination center. So it could be transportation, communications, all the way up to our utility companies. That coordination is taking place. The other key component for us to do is to make sure we have a common operating picture and correct situational awareness. And that coordination leads into that report, so that we're all understanding exactly what the situation is that we are facing. And then, of course, logistical coordination and ordering is a main component of the Multi-Agency Coordination Center, and it's the most challenging one for us right now. As Undersheriff McMahill spoke of just a moment ago, we did learn a lot of lessons from 1 October, but this is a different event for us. In 1 October, if we needed a resource, we called that resource, and the entire country was willing to bring that resource to us right away, and we've been willing to do that moving forward to other communities. This one's different because the entire world is competing for some of the same exact resources that we are working together to get. But we have been successful. We do have what we need to meet our needs now. We are forecasting our future needs and being very aggressive in making sure that we have the supplies that are available for that. And of course, the PPE has been very well documented, and that has been the number one challenge for us today. but certainly for emergency services, we are able to provide our services with the PPE with some modifications that we've all had to make as to the use and the adjustments that the CDC has recommended. But those are the main components of the Multi-Agency Coordination Center today. Of course, above PPE or along with PPE is a medical surge, and we're working with all of the area hospitals led by UMC to go ahead and make sure that we are ready if this continues and we have a surge capacity that expands past our present capabilities. But those plans are in place. Those actions are taking place right now, and just want to let you know that Clark County is doing their part to make sure that we are up for this challenge. So thank you very much, and I'll turn it back over to Commissioner Kirkpatrick at this time.
Thank you. And I really want to, again, thank the county commissioners who have been working tirelessly in different avenues to ensure that we are meeting the needs of the community. I want to express to the community, we will get through this. We will do it together. We're a very collective community, and that's where this multi-agency comes into play. So all of the mayors are meeting together. Staff is meeting on different fronts. Some of the examples of things that the policy committee has done. Policy committee addressed the business licensing issue. What does that look like for businesses? If your license is due today, what are we doing as a community? How are we consistent to ensure that you can still operate your business when the time is ready? Councilman Black, who is the chairman of the health district, has been working tirelessly to ensure that the health district is prepared as well when businesses need to open back up. So many folks across the valley have come together, whether it's been our businesses donating PPE, whether it's they have been there to give us resources. And so I say to you, you ask all the time, what can I do to be helpful? So there's a few things that we're looking for that we want you to think about. One, if there's any retired doctors, nurses that are out there and you're willing to come back, please contact us at the MAC so that we can have that resource available. Two, if you have some centers that you want us to look at that could be used for our medical surge, please reach out to the MAC and give us that information. If you truly just want to volunteer, please reach out to the United Way because they are working and coordinating with the MAC to ensure that we get people out. Four, if you want to provide food services, we've had a lot of those calls. Please send an email with your proposal. How does it work? Because that helps us help you and know what resources that we have. I couldn't be more proud to live in a community that is truly out front. Everybody's willing to help, rolling up their sleeves, and we will get through this together. We will rebound, and it is going to take all of us. So thank you for coming out. Please don't hesitate to reach out, and we hope to have these at least once a week to bring the mayors and different partners different times so that we can tell the community exactly what is going on and how we are working through this together. So this time we'll take some questions. Yeah.
How many beds have been secured today, and do you have an anticipation for when that goal of 500 to 1,000 will be reached?
I'm going to ask Mr. Schiller because we're working on that hourly.
Good morning. So as I presented earlier, we're working with tons of partners trying to figure that out. Depending on which population you're addressing, so when we look over at Cashman and we look at kind of the positive IDs where we're dealing with the homelessness population, we're looking at trying to house about 500 individuals there, depending on the circumstances. We also are in the process, we have transitional housing facilities that we're currently working with. We have about, at this time, about 200 plus beds that we can secure there. We're also looking at rehabilitation facilities. There's one that has 100 plus beds that we're working on leasing at this time. We really, as Commissioner spoke about, this issue of the medical surge, it goes across all populations. So one of the key pieces when we secure these motels, for example, with 200 units, they have individual air systems, which allows for us to house differently. But as I spoke about earlier, the other piece of that is depending on the acuity of the patient, we also have to have program support. So that's one of the pieces that creates a little bit of complexity. But at this point, with that 500 on the homelessness side, and then when we look at just additional capacity, it's at a minimum of at least another 300.
Sure. And then on the homeless side with the Cashman Center, that's not being counted towards that goal of 500 to 1,000, right?
No. So that's very specific to that population, but it will cross over at one point because you're going to have people as they become healthy. We want to support them and place them independently.
Go ahead.
I have another question just about hospital bed shortages. We've seen projections of potentially mid-April, late April, some say maybe early May. Has there been any assessment and any conclusion in terms of when we expect that we'll reach that peak in terms of our hospital capacity?
I'm going to go ahead and have Mason and then Chief Steinbach follow up with that. Chief Steinbach has had a team that is out looking at what capacity that we'll need, but go ahead, Mason.
So the question was on hospital capacity and the surge that we talk about and how do we flex up. So just as all state hospitals, all the hospitals in Nevada, we're all working towards flexing up to about 150% of our current bed capacity. What we're seeing at the hospital, and it's been alluded to, this virus has no boundaries. It's not selective. The patient populations that we saw in other parts of the world are not the same that we're seeing here. At UMC, we've seen ages from 20 all the way up. And again, that underlying modalities, hypertension, cholesterol, all those underlying diabetes, it's about 50% of the population. So we're seeing it happen in healthy individuals. So we're all trying to work up to 150% of our current bed capacity, and we're doing that in unconventional ways. You've heard about some of the alternative facilities. We've requested a mobile tent through the Mackay to be able to flex up as well, but we're looking at alternative care sites. All of us are doing that collectively, but we've also within the hospitals taken our current units, our current beds, and created containment units to be able to care for those patients in a contained way where we're conserving and utilizing our PPE, our ventilator, our staff in a very efficient way. And again, if people stay home and if they're sick, talk to the primary care physicians, utilize the emergency room when you only need to. That will help us preserve and be on defense for all the hospital beds that we have today.
Yeah, so I believe Mason covered everything with that question, of course, but I'll certainly take any follow-up. The only thing I'll add is that we do have a multi-jurisdictional team that is working specifically on this issue to make sure that surge capacity we have that plan in place. But to Mason's point, the very best place and what we want to do is to make sure that the patients that need that level of care are in the excellent hospitals that we have right now, and not in a secondary facility. So the plan would be that those other facilities could take other patients that don't quite reach that same level of care, and we could utilize our hospitals right now for the highest level of care. But there's multiple sites, multiple levels of the plan that are being put into place, and then planning on beyond that planning. So what's worst case scenario today may not be worst case scenario tomorrow. Maybe tomorrow it's better, maybe tomorrow it's worse. We're making that adjustment as that comes through, and that's what we do. And so we've made that number of 500. If 500 we never need that number, that's a great thing. That's what we all hope. We all hope that we don't even need anything close to that 500. If we all of a sudden we need to exceed that number, we're not going to be waiting until that's the case to make that plan moving forward. We will have already had that plan in place and identified and understanding of how to surge past that number moving forward.
Okay, if there's any other questions, one more. Come on. You give them the options.
Just a quick question about testing and homeless. We had heard that there would be testing done at Catholic Charities. Can you talk a little bit about that in terms of what testing might be done and how many tests are available for the homeless population?
So my understanding, so we've been working to get Catholic Charities back open, and they're supposed to open today at 3 o'clock. The health district has been working in particular with Catholic Charities. And so the plan is today, when they open, and the protocols that have been discussed between the health district and Catholic Charities, is that we will do screenings for folks that come in. So health district employees will be there for the first few days until their staff is up and ready. So they will do screenings, and then once if we find someone that meets the screening issues, we'll send them over to our Cashman facility, where then they can get a further testing protocol and go through that process with the homeless. Okay, with that, thank you so much for coming out. Thank you to, please stop to say thank you to the folks that are still working today. If you go to the grocery store, don't hesitate to say, hey, thanks, because they too have families. But I am super proud of our community. We are strong. We will get through this. We are ready. We are planning every day. We're meeting all the different challenges that come before us. But please know that this is something that we will get through, and you have many experts here within our own community that will help us do it. So thank you for coming out, and I look forward to seeing you next week with some more information. Thank you.